A key model is showing major signs of improvement as the death toll has now been revised down multiple times. The professor behind the model is Dr. Ali Mokdad from the Institute for Health and Evaluation, or IHME, University of Washington. Doctor, welcome back, and nice to see you again. We spoke earlier in the week, and thank you for coming back here. Why did the model change so dramatically from Monday to Wednesday? It was all good news, but why did that happen?
We have seen positive news from Italy and Spain where the peak went higher and down faster, and we implemented this new data, included them in our modeling. And we have seen better practices at our hospitals when it comes to need for ICU and ventilators. Our physicians are doing a better job on triaging patients, and we are seeing positive news, declining number of deaths, declining demand on our health facilities.
Wow, so many of us, I mean, we go to your website and we check out your information. We find it so critical to our understanding, as I know you're well aware. What is the state of play in America tonight as you look at your model?
So when I look at our models tonight, we are the worst is behind us as a country. So we're going to go down from now on in terms of number of mortality. Some states will have to peak a little bit later, but California, my state, New York are going to go down in terms of their numbers of mortality. So which is very positive as we move forward. The worst is behind us as a country. For some state, it will take a week or so.
Wow. So I just want to get this right. You said twice the worst is behind us. Is this the first time you have felt that way, or did you feel that way earlier this week?
No, this is the first time our data is showing that the mortality will be declining from now on, and the peak of deaths in the United States has occurred yesterday, and it will go down from now on.
Wow. On this Good Friday, that's good news.
It's a very good news for all of us, and it's time for all of us to start thinking about recovery and how we can bring our economy back.
Wow. That's the next part of my question, because you and I were going back and forth the other day, and you said, listen, I've got family and friends who are suffering too, and with respect to them as well. You're doing a new model next week that will break down, I believe, different parts of the country to tell you who and where you can reopen the economy and where it's best to keep it closed for the moment. Can you explain how that will work, Doctor?
So we're looking at different scenarios of modeling that we will release next week. One of it is we start going back to normal before a certain time or after. So May 1st, June 1st, what will happen? That's one. The second model that we have been asked to do, based on the data we have right now, certain state that they had non-essential business closure. We know what the definition of non-essential business closure was. We're going to model that certain businesses that were not closed in one state but in another, if we bring them, what will happen to the death rate and the circulation of virus again.
Well, so that could help the team at the White House determine who goes open for business again, could it not?
Yes. And it's very important for us, Bill, as we talk about reopening our businesses. We're not out of the danger yet. We need to stress that. But we need maybe to do it at phases and make sure we bring some people in and check there is no circulation of the virus. Testing is very important. Public health surveillance is very important. Isolation, case investigation. And after that, we feel more comfortable. We release more people. The careful here is, we're going to ask the most essential workforce to go back. And we don't want to put them at risk. This is the basis of our economy. So we have to be very careful who we ask to come first. We test them, we check there is no virus, and then if we feel comfortable, we can expand our relaxation measures and so on.
Well, I'm just going to take this headline, the worst is behind us, and fly into the weekend that way. Doctor, so good to see you. Dr. Ali Mokdad, University of Washington. We'll speak again next week, okay? Thank you, Doctor, for your report tonight.
Bye-bye.